Doctor, I am suffering from too much itching on the scalp. Severe itching, always scratching. I get a lot of bubbles on my head. If I touch, it is very painful. I have seen so many doctors, all kinds of shampoos and lotions. I am fed up. Very frequent complaints. People are always coming up with these kind of complaints, and they will have suffered for 2 years, 4 years, 6 years like that. And to discuss this problem of itchy scalp, I am here, Dr. Venkataram Mysore, dermatologist, hair transplant surgeon, Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Banashankari, Cunningham Road, Bangalore. What is an itchy scalp? Sensitive scalp. Anything which causes itching. So what causes itching? Basically, these are into two types of diseases. One, there is an obvious skin disease like dandruff, psoriasis, fungal infection, etc. In another category, there is no obvious skin disease. They will just have a sensitive scalp. They complain of severe itching. That is the second category. Now, in the first category, dandruff is a very common problem. Almost everybody has it, particularly when they are young. This is due to inflammation caused by Pittosporum ovale, a mild fungus present in the sebaceous gland of the hair follicle. That releases certain chemicals which leads to inflammation. Early stage, you get some powder which comes out as dandruff. Later it becomes reddish, and then you may even get some bubbles, pus called folliculitis. Usually it doesn't cause baldness. That is one thing everybody has to understand. But people are very anxious that it is leading to baldness. Treatment is quite simple. Specific shampoos to kill the fungus, lotions to control the inflammation, a protein-rich, vitamin-rich diet with fruits and vegetables, vitamin tablets. Sometimes, if it is more severe, we may use phototherapy or a tar shampoo. The important thing to understand is this is very easy to treat. The problem is the relapse and recurrence, which is partly due to environmental conditions. So the patients have to understand that they have to be on regular shampooing once a week at least for a long time. And when you apply these medicines and shampoo, apply it to the skin, not on the hair, because it is coming from inside. Leave it on for about 15 minutes so that it gets absorbed enough. Avoid smoking. If you are obese, lose weight. Don't eat too much of junk stuff and spicy stuff, that will increase the itching. And take a lot of fruits and vegetables. This is the management of itching due to dandruff. Now, in some people, the itching leads to bubbles or pus formation. Now, this pus formation in the scalp leads to what is called folliculitis. Folliculitis means inflammation of the hair. In many people, it comes 5 days, 10 days, they take antibiotic, it disappears. But in some people, it doesn't go. It keeps recurring month after month after month. What is it due to? This second type of folliculitis is different. What is happening here is the fungi, the bacteria, they are causing inflammation. And when they are taken antibiotic courses like 5 days or 7 days, that is not enough to eliminate them. So they persist at a low concentration. Patient doesn't have the immunity to kill them. So whenever the immunity goes down, these bacteria, fungi multiply and cause recurrent pus formation, bubble formation. Skin becomes tender when you touch like this. If the helmet is put on, that causes problem. Combing causes problem. That is a very sensitive scalp. Now, the treatment for this is in two ways. One, You have to take antibiotics, antifungals till the bacteria, fungi are eliminated completely. That may take 3 weeks, that may take 3 months. Till then, you have to keep taking. Number 2, in order to prevent the growth of bacteria, again, you have to boost the patient's resistance by giving iron, by giving zinc, vitamins, protein-rich diet, avoiding smoking, reducing weight, taking a protein-rich diet, lots of fruit and vegetables, good sleep, and avoiding stress. Very, very important. This is the management of this so-called folliculitis. Now let us come to the other category, which is a sensitive scalp. These people don't have any obvious skin disease. To look at, their skin is normal, but they complain of a lot of itching. What is the cause of itching in these patients? One, they may have some inflammation earlier. They may have this chronic folliculitis. Folliculitis subsides, dandruff subsides, psoriasis subsides, but the skin is in a little excited state, stimulated state, so it is sensitive. But the second main cause is these patients become very concerned about it, always thinking about it, and obsessed about it. So they keep touching like this, they keep scratching like this, they keep pulling the hair and see if there is pain. These are all symptoms of sensitive scalp. And in such cases, there is another element, what is called neurodermatitis, which means nerve plus skin, which means patient has stress which is releasing chemicals, which is leading to inflammation, which is leading to itching. These patients have to be managed in totally different way, which is, in addition to the antibiotics, the pain, the anti-inflammatory drugs, shampoos, etc., we have to moisturize the scalp, we have to use stimulating shampoos, we have to control smoking, proper diet, regular sleep, avoiding spicy stuff, avoiding junk stuff, chemical stuff, and get them to practice some yoga, pranayam, etc. This is very important. Diet has to be a sattvic diet, and the lifestyle has to change. That will lead to control of the situation. The problem is, young people find it difficult to do these things. So they keep going from doctor to doctor to doctor. Sometimes we use phototherapy, sometimes we use laser. All treatments are useful. But my suggestion to all young people, these are the ones which are exploited commercially in salons, in beauty clinics, spas, etc. They claim to do all kinds of treatment, will remove toxins from your scalp, detoxification of the scalp, all kinds of keratin treatments, and they often spend 50,000, 75,000. No, not needed. Simple treatments are enough, but persistent treatment is needed. Patience, proper lifestyle, relaxation, that is enough to take care of this. So don't spend money unnecessarily too much. I hope you have liked these videos. If you have liked them, share it. And if you think any more topics are needed, please suggest to us. Visit our website venkatcenter.com, and we will be able to come up with more videos. Thank you so much. Good luck. Good day.